Research is a critical tool that we have that give kids with disabilities and their families opportunities to live a good life. The Bloorview Research Institute, that we affectionately call BRI, is dedicated to discovering solutions for kids who have childhood onset disability. A lot of the work that we do at BRI is producing solutions and options for kids with disability in our hospital, in our neighborhoods, in our communities. We have made significant investments in the development of basic technologies, in the expansion of our spaces, but we have committed that this is not going to be the only place we have impact. We know there are not many BRIs around the world. We know there are 240 million kids experiencing disability around the world that do not have access to a BRI. And so we're developing this global community of practice for research in pediatric disability so that we can all teach and can all learn at the same time. So, as committed as we are to produce innovative solutions for kids with disabilities and their families, the truth of the matter is it takes a long time for those innovations to actually make it as part of the clinical care systems that we function in. In fact, there is a number that gets circulated quite a bit, which is about 15 to 17 years from a discovery to actually embedding that discovery in a care system where the children and the families can actually take advantage of it. We are obviously worried about this, so we also are making new commitments to think about how we're going to expedite the adoption of such discoveries by the healthcare system and make them available to families. The Social ABCs is an early intervention program that offers kids who either have a diagnosis of autism or at risk for developing autism early on in life, when they're toddlers, the opportunity to learn social skills, share emotions with their parents, and experience joy in the relationship with their families, and give skills to parents to help them with their social development as they grow up. This was a program that started as a series of research studies, but then we moved that program into what we call implementation science. So we studied how, in fact, you take an intervention that works and actually put it in a healthcare system so that kids can access it. And now this program has been moved all the way to being part of clinical care in several provinces in Canada, as well as several jurisdictions around the world. I'm also proud about the work that we have done and the investments we have put in the space, not just to develop technologies and solutions, but think critically about what contributes to a personalized version of a good life for every child who experiences disability.